Hey everyone. Today, we're diving into a pressing issue affecting millions in England, the looming crisis in mental health care. The NHS is under immense pressure, with over two-thirds of providers planning cuts, threatening longer wait times and reduced services. This isn't just about numbers, it's about the real-world impact on people's lives. Let's explore why this matters, the potential consequences, and what it means for the future of mental health care in England. First, let's understand the scale of the problem. According to The Guardian, millions of adults and children in England are facing longer wait times for mental health care. This isn't just a statistic, it's a stark reminder of the growing demand for support. Mental health services are already strained, and the proposed cuts are only going to make things worse. The impact isn't just on individuals, it's on the entire NHS, the economy, and public services. The services at risk are diverse and crucial. We're talking about child and adolescent mental health care, talking therapies, addiction support, crisis intervention for adults, and community programs targeting ethnic minorities and low-income groups. These services are the safety net for those in need, and cutting them could have devastating consequences. The numbers are alarming. A national survey by the NHS Alliance reveals that 68% of NHS trusts providing mental health services plan to reduce or shut down services in 2026 to 2027. That's almost three-quarters of providers. And it's not just about closing doors. 59% of respondents plan to freeze vacancies, and over half expect to cut clinical staff this year. This isn't a small-scale issue, it's a systemic crisis. Now, let's talk about the proposed solutions. The Prime Minister, Andy Burnham, has announced plans to create a network of community mental health centres and mental health ANES by 2029. This is a step in the right direction, aiming to improve access and provide more timely support. However, the question remains, how will these plans be funded? The mental health charities are right to raise concerns. If funding for staff and services is cut, any improvements will be impossible to achieve. The East London Foundation Trust is a stark example of the challenges ahead. They plan to cut a wide range of services and axe hundreds of jobs to close a £25 million financial gap. This isn't an isolated incident. Mental health professionals across other trusts are facing similar decisions. The fear is real. These cuts could strip away essential services, leaving professionals unable to perform their duties safely. The situation is dire, but it's not without hope. The NHS Alliance's survey highlights both the challenges and the resilience of the system. Despite the pressure, there are examples of innovation and great care. However, the trade-offs are becoming more apparent, and mental health leaders are under immense pressure. The higher proportion of staff expenditure in mental health services is a critical factor in these tough decisions. The survey results paint a clear picture. The need for efficiency savings is real, but so is the risk of underfunding. The focus on balancing the books could impede progress on care outside hospitals and preventive mental health care. One trust leader's words resonate: there's no investment for mental health community services, and teams are under-resourced to manage rising demand. The consequences of underfunding are far-reaching. As Alex Stewart from the NHS Alliance points out, mental health investment can't be allowed to fall behind. The impact on the wider NHS, the economy, and public services will be significant. Tom Pollard from Mind emphasizes the uphill battle to save mental health services and ensure high-quality care for all. The call to action is clear. We can't balance the books by sacrificing the most vulnerable. As Sharon Graham from Unite emphasizes, underfunding mental health provision only kicks the can down the road, leading to more significant costs in the long term. The government's response, while promising, must be backed by concrete actions and increased funding. In conclusion, the mental health care crisis in England is a complex and urgent issue. It requires a multifaceted approach, including increased funding, innovative solutions, and a commitment to prioritizing mental health. Let's use this moment to advocate for change, ensuring that the millions in need receive the support they deserve. Remember, this is about more than just statistics. It's about lives and the future of mental health care in our country.